We talking about the drugs treat blood disorder, and anti-inflammations and gout. So that's basically mainly working for the blood. Yeah, mainly working for blood. So in the blood, we say we have some blood cells. Mainly we have red blood cell and white blood cell and certain fragments in the blood cell. And this blood cell is producing in the bone marrow. The commonly illness in the blood circulation, pretty common, red blood cell disorder, like decreased amount or maybe functions of red blood cell. And certainly when red blood cell decrease, they sending to the circulation oxygen will be decreased. So that's the pretty commonly illness relationship with the blood. And the red blood cell, it's producing in the bone marrow, but it needs three important nutrients to producing red blood cell. One is the iron, one is the vitamin B12, one is the folic acid. These three things is helping to producing red blood cell. So red blood cell decrease in the blood circulation. They have a special illness name, anemia. This means not enough red blood cell in the blood circulation. And then cause the oxygen deficiency. So we say anemia can cause by separate reasons. Some people may be just iron deficiency. Then they couldn't build up blood cell. Some people just vitamin B12 deficiency. Or maybe folic acid deficiency. So different reasons cause different types of anemia. So we're talking about the irons first. So irons is pretty important to form the red blood cell. And it basically will combination with globin together form a hemoglobin. So we know inside of red blood cell we have a lot of hemoglobin. And each of the hemoglobin they will carry like a 4 oxygen. Yeah, they have a lot of inside. So hemoglobin is kind of protein. Yeah, it's kind of protein. It directly carries oxygen and then sending to the tissue. But when they build up hemoglobin, we truly need iron. If we don't have enough iron, certainly we build up hemoglobin. The ability will be decreased. and certainly red blood cells number decrease, and ability sending to the tissues oxygen is decreased. So that's one kind of the anemia. So these kind of anemia, because they don't have enough iron, so when they build up hemoglobin, they still build up some kind of like a hemoglobin and go to inside of red blood cell. But if we go to laboratory test, we put the patient's sample under the microscope. So basically, we can see that kind of red blood cell compared with normal people's red blood cell is a little bit smaller, and certainly it's because not enough hemoglobin inside. So that's they give it a special name, hyperchronic kind of anemia. So in other words, if we see this special kind of red blood cell under the microscope, that just means the patient's anemia caused the low iron. So iron deficiency can cause by different reasons. Certainly, iron deficiency causes anemia, but iron deficiency caused by different reasons. The common reason caused iron deficiency, certainly, like people didn't eat enough nutrition. Like some people, I would like to say, some people vegetarian truly cause a lot of problems. Yeah. We know lot of food, yeah, especially the meat, may contain some iron. But if some people, especially eating some food but not other kind of food, they may cause the iron deficiency. That's one reason, intake not enough. Yeah, intake not enough. And another reason, patient eating is normal, yeah, no problem. But the absorption have some disorder, like small intestine absorption function decrease, and people have some illness in the digestive system, and then they couldn't absorption. So that's another reason people couldn't get enough iron. And also some drugs, like if you use some special kind of drugs, and then they will like blocker the iron absorption. So that's another issue of patient eating no trouble. Originally, they stomach digestive system no trouble, but if you use some drugs same time, and then they will block the iron absorption. In one word, the iron coming is not enough. Yeah, whatever reason, decreased iron coming. And another reason, losing blood. That's go too much. Yeah. So just like a pool in here, we're thinking about the pool. That's a blood. Yeah, that's a blood circulation in the blood vessels or circulation in the cardiovascular system. And how much in there is depending why is how much is continually coming and how much will go away. So now we're talking about go away aspect, blood losing. Blood losing still have different aspects. Could be like chronic bleeding, like nose bleeding, and chronic like menstruation, too much blood lost. And also possible some people can losing some blood from digestion system, from digestion tract, but they didn't know it. Like some people have ulcers in the stomach, they continually losing some blood. But truly, if people bleeding in the stomach area, people couldn't see it. And even from the stool, just got some dark black color kind of stool. It's not like a flashing kind of blood coming out. People didn't pay attention. They don't know, but truly they're losing some iron. And other situations, some worms infections, parasites, and ulcers in the digestion. So that's losing part. Not losing part. So we say generally say 2 reasons cause the iron deficiency kind of anemia. Why is coming is not enough. Intake not enough. Absorption is not enough. Or maybe some medication blocker. And the other reason is losing too much. Losing too much. Chronic bleeding. So that's basically we finish cause of the iron deficiency is 2 main reasons. Then we talking about the PK of the iron. How drugs moving inside of the body. We need a daily requirement of the iron. Pretty similar like red blood cell. We say red blood cell living time, if you still remember, about 120 days. Normally. So we means like bone marrow continually producing red blood cell. And after 120 days, our liver and our spleen continually broken for the old blood cell. So continually red blood cell producing, certainly we continually need iron. So that's the daily we need for the male and the female. Because for the female we know like normally we'll have period. And during the period time losing more blood. And female need more building blood. Certainly need more iron. So that's normally amount for the daily. And for the children, maybe need a little bit more. And for the pregnancy woman, and even need feeding the baby kind of woman, even need more because like a circulation of the iron through the milk to the baby. So that's the thing. So we say normally, if the people like eating well and their digestion function is well, we don't necessarily to take supplements for the iron. That will be got enough iron from the food we taking. But like we say, if patient have chronic digestion illness, they couldn't absorb iron normally. Or maybe patient people just eating like some special kind of food. And maybe like for children, for pregnancy, they need more iron. That kind of situation maybe can take some like iron, like to build up iron. But generally say, normally we can get the iron from the food, from the food. So we say mainly coming from the meat. So that's why I say some people vegetarian, they may not enough iron coming from their food. And certainly, the salads still have some iron, but not as much as the meat. And we say the basically totally inside of the body for adults, that's the total amount in there. And about 2/3 in the circulation, in the red blood cell. That's the main thing. You are not necessary to remember the number here. Just remember the big amount in the red blood cell, in the circulation red blood cell. Then we talking about iron absorption. So iron absorption mainly happens in the diluvium. That's we say the first part of small intestine. Yes, still you remember, our small intestine separated with 3 parts. That's the first part, the diluvium. And the connected part, second part of the small intestine, diluvium. So that's mainly place. And the start part of the diluvium, the start part of the diluvium. So that's the mainly place the iron absorption. Certainly, if patients especially in this part have some illness, they will affect the iron absorption. So we say normally people will not have iron deficiency. We take some irons with the food, but only about 5 to 10% will be absorption. But even we only absorb it about 5 to 10%, people still without iron deficiency, normal. Normal. So sometimes, people absorption rate may be increased. We say normally only 5 to 10% will be absorption. But if inside the body, low iron storage need more, or maybe pregnancy still need more. And during the menstruation, losing loss and still need more. And for children, they need to grow up, they need more. And some other reasons cause the blood loss. So during this kind of situation, so basically, we need more iron. Yeah, we need more iron. So basically, we need to increase the iron take. And in this kind of situation, generally say our body maybe absorbs a little bit more. If still not enough, we need to give patients some like supplement for iron supplement. But if patient truly have like digestion issue, like iron deficiency truly caused by low absorption, that kind of situation, oral take may be not effective. So we say storage areas, storage areas. That's the form, like the iris combination with some protein and storage mainly in the intestinal membranes and also in the liver and the spleen and the bone. In the cells, macrophages, that's the cells we talk about the eating cell. They also can ask storage cells, storage for iron. So we say normally release in the stool, small amount, small amount. And also released by the bile and the urine and blood, still small amount. So basically, the excretions less than 1 gram a day. It's small amount, but we still need to continually to like intake iron. Otherwise, possible cause deficiency. So now we're talking about the treatment for iron deficiency. If you look at the simple, like we just don't have enough irons, we just try to take some irons. So orally take, that's a pretty common way, we can take, like orally take. That kind of form is like a little bit commonly or pretty effective to absorption by all digestion system. Yeah, we have different medication. That's the category form here. Then individually some medication just contains some irons and easily to take and easily like absorptions. So that's mainly. So we say when we orally take irons, drugs, iron drugs, and that can be absorption much higher than normally the absorption from the food. Normally the absorption from food is about 5 to 10%. But if we take some medication in the solid kind of form, we can go to about 25%. So that kind of iron. So we calculate by the daily we need and about 25% absorption. So that's the, if we take the drug, the dosage for the day. For deficiency kind of patient and rapidly go to normal. And we still need to continually use. So basically, as deficiency kind of patient, we need to continually use about 3 to 6 mass, and then can build up the iron inside the body. So oral take irons is easily used and pretty good absorption, but they have their side effects. The common side effects may be cause the patient nausea, vomiting, and cause the patient some uncomfortable feeling in the stomach area, and even possible cause some abdominal cramping, certainly some pain in the abdominal cramping, and possible constipation and diarrhea. So that's commonly way we build up the irons, but still have some side effects. Mainly side effects happens in the digestion system. And they say some people may be too severe kind of side effects, severe kind of vomiting, diarrhea, or abdominal painful kind of situation. And some people maybe have trouble to absorption the iron. Whatever you give, they couldn't absorption, still couldn't go to blood circulation. So in these two kind of case, so we need thinking about the other way to give the patient iron. Yeah, we couldn't use orally, or maybe the same time we give some orally, and then we use other ways. But mainly, it's severe kind of situation, we need to think about other ways. Like some people, because stomach issue, and surgery remove some stomach, and even remove some small intestine. So that kind of situation, truly they couldn't absorption for the iron. So in that kind of situation, we can use injections. We say we can deep injections to the muscles. Occasionally, not common. Occasionally, injection to the blood vessels, because injection to the blood vessels means the medication directly to the blood circulation. They possible cause severe kind of allergy reaction. It's pretty dangerous. They're pretty dangerous. So basically, we are not injection to the blood vessels, but we can injection to the muscles, deep muscles, but still have side effects. The side effect can cause local painful, can cause the tissue like painful tight there, and also possible cause headache. So we know when we use any kind of medication, injections, absorption is faster compared with orally use. And then they can cause the headache, and even some people may be fever, and still possible cause nausea, vomiting, but maybe not that severe. And also maybe skin rash, like bronchospasm, asthma, and still possible allergy. Severe case that usually caused by injection for the blood vessels. So basically, injection to the deep muscles mainly cause local problems. Occasionally cause some other issues. So that's basically we say for the irons, the best way orally take, even they have infections, but still not that severe. For people, severe kind of like side infections, like nausea, vomiting, abdominal pain kind of situation, so severe, and the patient have digestion issue, couldn't absorption. Then we thinking about injection to deep muscle. So that's basically the first illness. We're talking about anemia. Yeah, anemia. Anemia caused by iron deficiency. Thirdly, we have different other types of the anemia. But pretty commonly, iron deficiency causes the patient anemia. So that's the first illness we're talking about in this part. So this part, we're talking about blood symptoms. Yeah. Disorder in the blood. Yeah. Disorder in the blood. The first illness we're talking about anemia. Anemia. The first common reason cause anemia is the iron deficiency. Iron deficiency coming with two reasons. One reason is intake not enough. Intake not enough, including not enough suitable food to eating, including some absorption disorder. Another reason cause iron deficiency is losing too much. Losing too much. People eating is normal, but losing blood, long-term bleeding, some kind of situation still cause the deficiency. And the treatment for the iron deficiency. Certainly, we give the patient iron. Give the patient iron mainly orally use. Yeah, mainly orally use. But the people truly couldn't use orally because severe kind of side infections and maybe absorption disorder. We can use injection, but mainly injection to deep muscle. So that's about. Okay, so let's continue. We are still in anemia part. We say anemia can be caused by different reasons. We just finished caused by iron deficiency. Yeah, iron deficiency, and then cause anemia. Second one, we're talking about vitamin B12 deficiency. So vitamin B12 still are important to make like the blood vessels. Yeah, like blood vessels. So that's another important part. And vitamin B12 requires amount, still small amount, and still mainly from animals. So that's why like a lot of people they don't have enough like food coming from animals pretty easily cause anemia. Not only iris anemia, and also maybe vitamin B12 deficiency kind of anemia. So basically, we still have a lot of food high vitamin B12. And then we talking about PK. PK. That we talking about before, like how drugs moving inside body. So absorptions of B12 might be low compared with the iron absorptions, still in the small intestine, but lower part of small intestine. And after absorptions in there, and then transport to different cells of the body. So B12 can transport to the liver. Basically, can storage in there with the excessive kind of B12. Yeah. And some we still have too much, even with after storage, we still have too much. It's directly relieving in the urine. And functions, yeah, B12, yeah, B12 functions. When we talking about physiology, means normal, normal function, normal function. So basically, they're working, the relationship with producing DNA, producing DNA. They're working with like a coenzyme kind of productions and the relationship directly producing DNA. So DNA is so important inside the body. So that means vitamin B12 is very important. And also relationship with our metabolism, many aspects of metabolism. So the drugs or medication we use B12, certainly we use treat B12 deficiency or possible preventing B12 deficiency. So like pretty simple, like iron deficiency, we directly use iron. And like a B12 deficiency, we can directly use B12 to build up. So B12 deficiency can cause anemia. This kind of anemia is a big kind of cell anemia. It's might be compared with normal red blood cell. With the iron deficiency, the cell is smaller. But B12 deficiency, the cells is bigger, but still low function. So that's we need under the microscope. We got a different kind of shape of red blood cell. Give us a basic idea what kind of difference in there. And certainly we still can go to other laboratory tests, like kind of blood test. We can know it's truly iron deficiency or B12 deficiency. But different reasons cause the anemia and their cells shape. It is different. Yeah, it is different. So it's a pretty similar like iron. Normally, we are not necessary to take B12. We can get B12 from our food. So usually, patients have B12 deficiency because their absorption functions disorders. We're still talking about some people get surgery and remove some digestion tract and certainly cause a lot of disorders, including B12 deficiency. And treatment with B12, if patient's digestion system is normal, we still can orally take. But when we talking about B12 deficiency, we say mostly it caused by digestion absorptions disorder. So in that kind of case, oral take will not be effective because whatever you eat, they will not be absorbed. So B12 deficiency kind of patient will commonly used for injection to the muscles, especially patients have severe kind of anemia and long-term with injection. So if we think about preventing, we still can orally use. But for the treatment, especially severe kind of case, truly we need injection. That's for B12 deficiency caused anemia. Then we go to another kind of anemia, folic acid deficiency. Folic acid deficiency still can cause anemia. So we say mainly cause anemia. We have three deficiencies: iron deficiency, vitamin B12 deficiency, and folic acid deficiency. Because folic acid still are important, like producing for the subunit amino acid and purine and DNA. So that's still important. And the daily use even more smaller amount. So folic acid deficiency is not common. It's not common. And we got folic acid from lot of affected. We say coming from coming from kidney or liver, the animals certainly, animals, and some vegetables, and we just use a pretty small amount daily. It's not that commonly caused deficiency. Then we talking about decay, like the drugs moving inside the body or the moving. It's pretty easily absorption in small intestine. That's still small intestine. And storage during the liver, mainly, and some other tissues. So our body still storage like folic acid is not that big amount. It's not that big amount. So we still need like everyday build up in case it degrades. So we say that if your food, if you normal take food, you still not that easily cause the deficiency. But for some kind of situation, if patients have some other issue, still also cause folic acid deficiency. And normally executed in the urine and stool. So remember, any materials inside of body keep some normal metabolism. We need every day to come in, and we have every day to release. That kind of balance in there. So we say normally we are not cause the folic acid deficiency, but still some people also cause folic acid deficiency. So that's including some aging people. aging people truly their overall organ functions will be decreasing, including their digestive system, absorption, poor absorption. So lot of nutrition they couldn't absorb, so they are easily cause the folic acid decrease. And certainly in this kind of case, maybe also have vitamin B12 deficiency and iron deficiency at the same time. And the poor patient here means patient have chronic problem for long term, generally all over body deficiency, pretty similar like aging people. Their organ functions deficiency, absorption deficiency. And pregnancy truly need more, truly need more folic acid. And folic deficiency causes anemia, still big cells, big red blood cell, and still low functionally. Those red blood cell is bigger, and but truly looking function. So some new babies, they still possible got anemia caused by folic acid deficiency, and maybe some other disorders like a heart disorder. We talked about heart issue before. Some other congenital kind of disorder for new babies. Lot of reasons. It's the mom during the pregnancy. They have folic acid deficiency because we talked about folic acid. It helps to build up the DNA and build up the other structures of the cells. So truly, the pregnancy mom got folic acid deficiency will cause the form the baby's organs deficiency. So that's about folic acid deficiency and we say cause. We say cause the big reason. Special kind of diet. Not enough. Not eating enough. And also some people have some liver kind of illness, especially people long term drink alcohol and then damage liver functions. We know folic acid storage in the liver. If liver losing functions, they will not have function storage for folic acid. So that's called the deficiency. And other kind of anemia. That's basically people red blood cell broken rate is increased for some reason. Maybe medication, maybe some special kind of illness. We say normally red blood cell can live in 120 days. But these patients, like their cells still pretty young, and then they broken. So these kind of broken cause the anemia, and they immediately relieve from the urine or maybe from the stool folic acid. So inside the body, folic acid got decreased. And we talked about absorption disorder already. And possible some cancers and some blood disorder, producing blood disorder. And generally say any kind of disorder also can cause the folic acid deficiency. especially kidney. So that's a lot of reasons can cause folic acid deficiency. And then we talk about the treatment. So treatment, truly, we give patient need what kind of things we give patient, what kind of things. Yeah. We give patient orally take that the 1 gram per day. It's not necessary to big amount, but truly we need to use every day. And we can prevent it. If some people have more red gut deficiency, like people got pregnancy, we can even use supplements to prevent that kind of deficiency. So that you can use up to 1 gram, up to 1 gram. Not necessary to use big amount. And other issues patients, we talk about patients always drink alcohol, damages the liver functions, and patients with other kind of anemia and other kind of liver issue, and even some skin issue and kidney issue. These kind of patients, we can use some folic acid orally use to do some preventing. So that's for folic acid deficiency caused anemia. So that's basically we finish 3 different kinds of anemia.
Drugs used to treat the diseases of blood. The mostly common blood disease is anemia. Anemia is a condition in which people lack enough healthy red blood cells to carry adequate oxygen to the body's tissues. Having anemia can make people feel tired and weak. There are many forms of anemia, each with its own cause. Anemia can be temporary or long-term, and it can range from mild to severe. Red blood cells, RBCs, or erythrocytes are the most abundant cells of blood. Their main function is to deliver oxygen to all tissues in the body. 1% of circulating RBCs are reticulocytes, which develop in the bone marrow and mature to RBCs after 1 day in blood circulation. It is important to note that RBCs do not have a nucleus. Hemoglobin in RBCs. Hemoglobin transports oxygen from lungs to the cells in the body. The hemoglobin molecule contains iron, an essential mineral found in our diet. Hemoglobin is an iron-rich protein in red blood cells. Oxygen entering the lungs attaches to the hemoglobin in the blood, which carries it to the tissues in the body. Folate is a water-soluble B vitamin that occurs naturally in foods. Folic acid is the synthetic form of folate that is found in supplements and added to fortified foods, such as white flour, white bread, and a variety of pastas and nutrition bars. Folate has many functions in the body, helps tissues grow and cells work. Works with vitamin B12 and vitamin C to help the body break down, use, and create new proteins. Helps form red blood cells, helps prevent anemia. Iron is an important component of hemoglobin, the substance in red blood cells that carries oxygen from lungs to transport it throughout body. Hemoglobin represents about 2/3 of the body's iron. If body don't have enough iron, it can't make enough healthy oxygen-carrying red blood cells. Causes of anemia. Different types of anemia have different causes. Iron deficiency and folate or vitamin B12 deficiency are the common type of anemia. Iron deficiency anemia. This most common type of anemia is caused by a shortage of iron in the body. The bone marrow needs iron to make hemoglobin. Without adequate iron, body can't produce enough hemoglobin for red blood cells. Without iron supplementation, this type of anemia occurs in many pregnant women. It is also caused by blood loss, such as from heavy menstrual bleeding, an ulcer, cancer, and regular use of some over-the-counter pain relievers, especially aspirin, which can cause inflammation of the stomach lining resulting in blood loss. Treat iron deficiency anemia could oral take iron, intramuscular injection, or intravenous injection iron, but intravenous injection may result in very severe allergic reactions, and should be avoided if possible. Vitamin deficiency anemia. Besides iron, body needs folate and vitamin B12 to produce enough healthy red blood cells. A diet lacking in these and other key nutrients can cause decreased red blood cell production. Also, some people who consume enough B12 aren't able to absorb the vitamin. This can lead to vitamin deficiency anemia, also known as pernicious anemia. Treat these kinds of anemia. Patient need to take folate and vitamin B12. Coagulation is the other problem of blood. Coagulation, also known as clotting, is the process by which blood changes from a liquid to a gel, forming a blood clot. It potentially results in hemostasis, the cessation of blood loss from a damaged vessel, followed by repair. The mechanism of coagulation involves activation, adhesion, and aggregation of platelets, as well as deposition and maturation of fibrin. Coagulation begins almost instantly after an injury to the blood vessel has damaged the endothelium lining the blood vessel. Exposure of blood to the subendothelial space initiates two processes: changes in platelets, and the exposure of subendothelial tissue factor to plasma factor 7, which ultimately leads to cross-linked fibrin formation. Platelets immediately form a plug at the site of injury. This is called primary hemostasis. Secondary hemostasis occurs simultaneously. Additional coagulation, clotting, factors beyond factor 7 respond in a cascade to form fibrin strands, which strengthen the platelet plug. Disorders of coagulation are disease states which can result in problems with hemorrhage, bruising, or thrombosis. Coagulation is highly conserved throughout biology. In all mammals, coagulation involves both a cellular platelet and a protein coagulation factor component. The system in humans has been the most extensively researched and is the best understood. Aspirin is a mostly common use drug to treat coagulation illness. Aspirin, also known as acetylsalicylic acid, ASA, is a medication used to reduce pain, fever, or inflammation. Aspirin inhibits granulocyte adherence to damaged vasculature, and inhibits the migration of polymorphonuclear leukocytes and macrophages into the site of inflammation. Aspirin given shortly after a heart attack decreases the risk of death. Aspirin is also used long-term to help prevent further heart attacks, ischemic strokes, and blood clots in people at high risk. It may also decrease the risk of certain types of cancer, particularly colorectal cancer. For pain or fever, effects typically begin within 30 minutes. Aspirin is a non-steroidal anti-inflammatory drug, NSAID, and works similarly to other NSAIDs, but also suppresses the normal functioning of platelets. One common adverse effect is an upset stomach. More significant side effects include stomach ulcers, stomach bleeding, and worsening asthma. Bleeding risk is greater among those who are older, drink alcohol, take other NSAIDs, or are on other blood thinners. Aspirin is not recommended in the last part of pregnancy. It is not generally recommended in children with infections because of the risk of Reye syndrome. High doses may result in ringing in the ears. What is gout? Gout is a type of arthritis that causes pain and swelling in your joints, usually as flares that last for a week or two, and then go away. Gout flares often begin in your big toe or a lower limb. Gout is a familial metabolic disease. Gout happens when high levels of a substance called serum urate build up in the body. When this happens, needle-shaped crystals form in and around the joint. This leads to inflammation and arthritis of the joint. However, many people with high levels of serum urate will not develop gout. Formation of uric acid calculi in the kidneys may also occur. Gout is usually associated with high serum levels of uric acid, a poorly soluble substance that is the major end product of purine metabolism. The treatment of gout is aimed at relieving the acute gouty attack and preventing recurrent gouty episodes and urate lithiasis. Colchicine is absorbed readily after oral administration. Metabolites of the drug are excreted in the intestinal tract and urine. Colchicine dramatically relieves the pain and inflammation of gouty arthritis without altering the metabolism or excretion of urates, and without other analgesic effects. Indications: colchicine is used for alleviating the inflammation of acute gouty arthritis. Adverse effects: colchicine often causes diarrhea and may occasionally cause nausea, vomiting, and abdominal pain. Colchicine may rarely cause hair loss and bone marrow depression. Thanks for watching.
So basically, this part is we have 3 units. The first one, we finished already. Then we're talking about the second unit in this part. Calculation. What means calculation? So that means some homeostasis or maybe some clot happens in the blood circulation. So basically, we say normally, if people have some broken in some part of blood vessels, and then, like we're talking about blood vessels injured, then locally blood vessels spasm will be happening. When we're talking about blood vessels spasm, we need to thinking about the diameter of the blood vessels. Like we see the transfer of blood vessels like this. If we're looking from side blood vessels like this, when they spasm or contraction, truly they make blood vessels diameter that smaller, like a contraction, like this way. So that's truly, if some injury here, they're changing from big hole to smaller hole, and certainly easily cause like stop bleeding. And after blood vessel spasm, some blood lines will go to there or touching there. Some blood lines from inactive form changing to active form. And a lot of blood lines go to there. And we also, in our blood plasma, we also have some protein, basically, could be from number 1 to number 13. We'll go to there also, form the clot. So that's pretty complicated process, but generally speaking, this process is normally, basically, just happens during we have injured blood vessels. Some bleeding happens kind of situation. Our body systems try to stop bleeding, but for pathology, like some other issue happens, like we talking about before, people eating too much fat, and too much fat go to blood circulation and then are touching to the blood vessels. Certainly they will form some and smoothly inside blood vessels there. And our systems thinking about that injury. They need fix. Then platelets coming. Then some fabric coming. Then they cause the bigger and bigger kind of clot in there. And severe kind of case, they could be blocking whole the small arteries in some area. Certainly, if they blocking coronary artery, they will cause heart attacking. So this kind of situation is pathology kind of situation, and even severe kind of situation. So we're talking about pretty important drugs treat this kind of situation, or even preventing this kind of situation. So aspirin, aspirin belongs to anti-inflammation kind of medication. Aspirin originally treat painful disorder, like muscle pain, joint pain kind of disorder that originally they used. But later on, the doctor found aspirin have pretty effective in preventing like the blood issue. We talked about coagulations, means like some blood blocking by the platelets, like aggregations and some fabric together blocking the blood circulation. In other words, I think commonly talking about aspirin is the medication make the blood thinner. So when we're talking about pharmacology, we're talking about two aspects. One aspect is PK. PK means drugs go to inside the body, how their metabolism, how their absorption, and how their finally expiration. So aspirin is pretty faster absorption from the stomach and upper small intestine. It's good. Yeah, we're talking about it's working immediately. But bad things, they may damage like the stomach and small intestine, the mucosa. Yeah, so that's like a side effect. So activated in the unchanged form, that's one possible, and also can excrete by changing the form, released by the urine from the kidney. Then we're talking about aspirin infection. We say the main infection or original infection, we say aspirin have anti-inflammation kind of infection. So basically, they like have inhibited for the red blood cells, like attaching each other and damaging blood vessel function. So that's basically happens in the inflammations. Like last semester we talked about pathology. We say inflammation is local reactions. Basically, it's kind of redness, swollen and heat and painful. They coming from like dilate blood vessels first, and then lot of cells go to locally and cause swollen locally. So basically, aspirin can like inhibit the cells go to locally. So that's can reducing some local painful situation, can reducing some like a patient feel some painful situation to local. So that's originally we use, and basically we can use for like a muscle pain, joint pain, and even go to some after dentist work, we can use aspirin, basically relieve some painful situation. So aspirin have another function, reducing body temperature, reducing fever. Yeah, it's not like reducing like a normal body temperature. Just when people have fever, it's reducing the fever. Yeah. So that's basically they dilate the blood vessels and holding more blood in the blood, superficial blood vessels, and can cause some sweating. And through the sweating, reducing the fever. So that's another aspect. Yeah, another aspect. So that's originally we use for aspirin. Yeah, pretty old drugs. Yeah, pretty old drugs. And even like everybody pretty familiar, like they can reduce the pain, they can reduce the fever. Even sometimes for children have high fever, you can take some aspirin. But like we say, be careful use aspirin. They will damage the digestive system, especially stomach, may cause stomach pain. And the long-term big dosage use may cause stomach or maybe small intestine ulcers. So that's the mainly side effect. Pretty be careful. And later on, that's new funding, like 30, 40 years, they can working for the plasma. Yeah, they can working for the plasma. And inhibit actions for plasma. We say when the blood moving inside of the blood vessels, normally they pretty smoothly moving there, pretty easily. But if lot of blood lines like aggregation together, that's truly blocking the blood flowing. So aspirin truly have these kind of functions, prevent or inhibit blood aggregation. So that's making the blood flowing inside blood vessels smoothly. And it can work in 8 days. Yeah, 8 days. So that's basically pretty good result. If patient have these kind of problems, we can use aspirin. Then we talking about clinical use. We say clinical use. We say that originally pretty commonly used, like relief pain. That's originally different kind of pain, different kind of pain. But remember, they are not treated for abdominal pain. And the severe kind of organ pain, not treated with aspirin. basically muscle pain, joint pain, internal organ pain is not working. Yeah, it's not working. So we treat some arthritis, and we can reducing some fever kind of condition, and other like swollen joints kind of condition. Swollen joints cause a painful condition. That's pretty commonly clinically used. And we say recently, it's like 30, 40 years, something like that. We found they have actions inhibited platelets, like aggregations together, but truly blocking the blood flowing. So we can use aspirin. So that truly decrease the risk for some people got heart attack. So that's the illness, coronary artery totally blocking, totally blocking. That's usually we say heart attack. And some agenda, pretty commonly happens, yeah, pretty frequently happens. So that's preventing. So like recent years, some doctors will suggest the patient if they have this kind of disorder with the blood circulation, they use small dosage of aspirin and keep taking sometimes. And it reducing the risk, like caused by coronary artery blocking there. So that's still like blood blocking kind of disorder. So that's about aspirin. So aspirin, we say the only things need to be careful. Stomach. People have stomach issues, severe kind of ulcers in the stomach, small intestine, maybe not shoot for use aspirin. And if we use for relief pain or reducing the fever, maybe not long-term use, short-term use, but truly preventing for like a heart issue, working for the like a bloodline, we truly need a long-term use, but small dosage, yeah, small dosage, not big dosage. So that's about these illness, blood issue. Then we go to another illness, gout. So gout is the illness. The symptoms look like happens in the feet or hand. Yeah, mostly it's the small joints. Yeah, small joints, swollen and painful. It usually happens in the big toe. Usually happens in the big toe. But still possible happens in other toe or even the hand, the finger, joints swollen and painful. Yeah, and painful. So gout, why we put gout in here? Look like we didn't talk about the illness. Because that's the illness relationship uric acid molecule in the blood circulation increase, and then they cause the joint problems, even cause the kidney stone. So means these problems is not like just locally, like a joint problem, like usually we talking about arthritis. It's symptoms like arthritis, but truly the problem happens in the blood circulation. Uric acid is high level in the blood circulation. It can cause the joints pain, swollen. It can cause the kidney stone. So that's why we put in this part, in blood circulation part. So basically, it's a relationship with serum metabolism. So that's the illness. So that's just swollen painful area. Patient like first symptoms, they may feel some like we talk about urinary hypertension in the big toe, big toe. Basically they feel big toe, some painful in there, and from the beginning it can be disappeared, and then come back again. So these kind of situations, we will suggest patients go to laboratory test and test for their blood levels, uric acid levels. So basically, they have high uric acid level, and pretty dangerous for these kind of patients. Pretty easily cause kidney stone. So treatment. Look like we are pretty hard to truly treat like low blood levels, uric acid, but we mainly like treat when it attacking or maybe prevent they happen again and prevent some kidney stone kind of issue happens. So the medications, we have typically used the medication here. One medication that's orally take. Its absorption is faster, and metabolism or release in the intestine and the urine. So basically, these medications, they work in relieve pain in the joint, and they relieve the inflammation locally in the joint. But like we say, it's not truly working like for the blood level. The blood level is like high level uric acid in there. But truly they're working for relieve pain locally and relieve inflammation locally. Still kind of good medication we can use for this kind of patient because this kind of patient cause the mainly trouble, painful situation, mainly in the joints. But like we talked about other medications, they still have like adverse effects. They can cause diarrhea. The absorption in the intestine. They may cause diarrhea and also occasionally may cause nausea and vomiting and possibly cause abdominal painful situation. So that's the commonly side effect. Pretty small case. Some people may got hair loss and maybe cause bone marrow. We talking about the depressed here means bone marrow producing blood cells functions decrease. So that's still cause problem. Like decrease the red blood cell, and blood cell. So like people, like for example, in our clinic, some people come in and they will say they got the problems like the gout, and they treat problems. They talking about, oh, I have joint pain, especially in big toe in there, and I got my family doctors to check, and the laboratory check. They tell me it's gout, and they give my medication to use. The painful situation looks getting a little bit better, but recently I got more hair loss. So in this kind of situation, you can tell the patient that's coming from the side effect of this drug. So that we need got more knowledge from different kind of vice illness and different kind of common use drugs that truly clinically we can use. Otherwise, don't know why people like hair loss risk. Another category. Yeah, another category medication. Basically, we still can use treat gout. So we put these medication together. Some medication belong to anti-inflammation drugs, and we still can working for the gout. So these kind of medications basically is working for some kind of uteric kind of how we say it. If some cells can eat some the materials and form the stool in the kidney. So basically that's relieving, like we try to treat the root of the illness. So that's we say originally we still treat the gout, but look like this category is not that kind of successful like we just talking about the medication before. But clinically we still can use like acute infections, we still can help each other and then treat it. So that's